Hi, good morning everyone. I am Monica. For today's video, I am going to show you on how and what are the procedure about the competency of the deep wound with tunneling and undermining. So before we get started, I gathered here all the equipments that we are going to use, which is already sterile. We have it here, the tray, the forceps, some medical scissor, syringe, saline solution, antiseptic or betadine, micropore tape, barrier or protectant, gauze roll, clothes pad, waterproof underpad, gloves, sterile gloves, garbage bag, PPE, mask, and hairnet. So, hi Miss Lovely, I am your student nurse Monica. Before we get started, may I got your name and your date of birth? Okay, thank you. Do you have any allergies? Okay, so I'm just gonna make sure that I give you some kind of privacy. So I'll be here with you for about 10 to 15 minutes. I'm going to remove the dressing change of your wound, and after that, I will replace to a new dressing. Do you have any question before we get started? Okay, so I have your consent to proceed then. Before that, I have some few things to be set up first. So I will perform the hand hygiene first. And now I'm going to wear the PPE or personal protective equipment. Is any slushy? Next, our mask. Next is our hairnet. Next, we have to wear the normal gloves. Okay. Let's grab the waterproof pad. You have to put the underneath of your leg because we are doing some irrigation later. Let's grab the saline solution and I will put in your wound just to make sure that you will not get hurt. And I'll be careful with that. Mind. So enough. And next, I am going to remove now the dressing of your wound. Slowly. So at this point, we have to check if there is any signs of noise, changing of the color, and the amount of consistency odor. And we will evaluate that one. And now we will dispose this to the garbage bag. So now we are going to remove the gauze pad inside of the wound using by the forceps. And we will dispose to the garbage bag. So now let's grab the saline solution and irrigate the wound with an easy squeeze bottle. And now let's remove the gloves. And let's throw it to the garbage bag. And after that, again we will apply the sanitizer one more time. And we were going to use the sterile gloves. Of course, you have to make sure that you didn't touch the gloves inside. And now we are going to measure the wound's length, width, and depth if there is undermining or tunneling are present. And now we have to put the saline solution to our mixing bowl. Next, the antiseptic or betadine. And now, let's fill the syringe with diluted betadine or prescribed wound solution and start to flow or irrigate your wound gently. And now, let's grab the gauze roll and cut it into small pieces, then put in the wound. And you can put also the gauze roll soaked with the diluted betadine. The wound must be moist, not wet, and we can grab more extra gauze. Make sure that you didn't pack too tightly, and dry the wound edges with sterile gauze using forceps to prevent maceration of surrounding tissue from excess moisture. And now, apply a skin barrier or protectant to prevent itchy or irritation to your skin. After that, you can cover the wound now. And lastly, we have to put micropore tape so that the cover will not fall. Make sure all the wound edges are secured now. That's all. We already covered the wound of the patient. And make sure that you dispose all your materials that you have used. Now, let's remove the gloves. Right here, the garbage bin. Let's do the hand hygiene. Now let's remove the back side of the PPE, which is here. Let's drop it here. Let's remove the hairnet. Right here. And right here. Slowly, like this. Roll it. And throw it to the trash bin. Put my pen somewhere, and that's it. I hope you enjoy and you learn something about my activities on video and how and what are the procedure of the deep wound with tunneling and undermining. Thank you. Bye.